Ready for another myth-busting AMA? Let's talk adrenal fatigue. So, fatigue is usually something I describe as when your reality doesn't match with your desires. You don't have the energy you want, the motivation you need. You just can't seem to accomplish what needs to be done for the day. It's not an uncommon feeling. It happens to everyone periodically. It happens to the best of us. Maybe you didn't get enough sleep the night before, you didn't eat as well as you should. So you might be fatigued the next day. I get that. But there's a different level of fatigue. And when people come to the office and they're complaining about something called adrenal fatigue, or they've read about it, or they're concerned about it, it's a different level of fatigue. That's a endless, day in, day out, nothing that you do seems to alleviate or help you get through that wall of energy block, right? So you're changing your diet, you're exercising, you're doing all the things you're supposed to do. And I'm going to assume that you know what you're supposed to be doing there. And so you're dieting and exercising appropriately, you're living a healthy lifestyle, and yet you just can't seem to function. We hear that a lot, and that is a really common complaint that people come into the office with. So why are we myth-busting adrenal fatigue? Well, because adrenal fatigue in that term is a marketing ploy. It doesn't actually exist. If you had true adrenal fatigue, that's known as Addison's disease. And adrenal failure in the form of Addison's disease is an autoimmune disease where your body attacks your adrenal gland. You don't make the hormones correctly from your adrenal gland. And that's a life-threatening situation. So you have unexplained weight loss, you have unhindered fatigue, you have electrolyte disturbances, low sodium, high potassium. There are a lot of things that you can see is wrong in someone's case or someone's medical care that help point the way to something like the adrenal glands failing. So true adrenal fatigue is a life-threatening disorder, and we know how to diagnose it. It's not hard. You will not go months, you will not go years, you will not go decades with adrenal fatigue. It just doesn't happen. So with that being said, what does look like fatigue that is not adrenal, but is hormonal potentially or metabolic? There are a few things that we see in the office that may be in play for you if what you've done has not been working and you're really struggling to find your way energy-wise. So, for the most common reason, for women really more than men, is low estrogen, low hormone function, also known as perimenopause and menopause, right? So if you are not experiencing good hormonal function as a female, right, for monthly cycles, and this may actually apply to people who are on birth control pills as well, or other hormone medications or other hormone contraceptives, it can be really fatiguing for some women to not have a normal monthly cycle or to not have good hormone levels, whether that's birth control that you're taking or some sort of contraceptive that's messing with your hormones, or perimenopause or menopause. Hands down, most common reason I see in my office. Now, the reason I said that doesn't apply to women or to men like it does to women is that men don't experience fatigue in the same way as women when it comes to low testosterone. They tend to get more like behavioral and more productivity changes, whereas women tend to internalize it. So whereas women get that fatigue internally, they still push through, they still get their job done. Their mood tends to be similar in the sense that they can be crabby, they could be short. But it's really interesting. Men and women seem to experience low hormone levels somewhat differently in terms of their symptoms. So don't compare yourself to your spouse or your friends or your partner who may be experiencing low hormone levels or fatigue. It just looks different sometimes for different groups of people. And that's totally expected, but could still be fatigue. So it's the most common reason I see is changes in hormone status. The next most common reasons, believe it or not, actually have to do with some vitamin levels. Now, the vitamins are kind of tricky, right? Everyone's out there with all kinds of different vitamin supplements and lots of different things that you can take or should take. There's a lot of different instructions out there, but I'm going to speak to two very specific ones that maybe you haven't really associated as being potentially a cause of fatigue. Because like I said with the lifestyle, I'm assuming that you are paying attention to your overall health. And if you have anemia or you have some other really major health issue that's causing the fatigue or contributing to your fatigue, you've already spoken to your provider about it. You've already looked at these issues. So I'm talking about things that are maybe next level. You haven't really thought about, maybe your provider hasn't thought about, is vitamin D, specifically, the first one. And the second one has to do with your B vitamins. I'll hold that thought for a minute and we'll get back to it. So vitamin D is a situation where it is a hormone. It isn't actually a vitamin, and it controls the entirety of your hormone cascade, the production from all the basic hormones, all to the most advanced hormones. It involves cholesterol management and blood pressure management and blood sugar management. It truly is a hormone. And when you look at the epidemiologic origins of vitamin D, true normal is somewhere between 65 and 85 on a lab test. So if you are experiencing extreme fatigue with muscle pains, muscle aches, maybe even bone pain, maybe you're developing some new blood pressure, blood sugar problems, take a look at vitamin D. And that may be where you are suffering some deficiency or insufficiency. It could be maybe a little bit better than it has been. So that's the next most common one after hormone status like perimenopause, menopause, low testosterone. Then the next one having to do with vitamin B is something that I'm going to refer to as MTHFR, the methyl tetrahydrofolate reductase enzyme system. Say that fast 3 times. Really is about how B vitamins are metabolized in your body. So a lot of people understand that B vitamins are absorbed from your food. You might take them in as a vitamin, you might take a supplement, you might take an energy drink, but those are usually an inactive form of B vitamin. They're usually readily absorbed, but they have to be converted in your body in order for them to become activated or to enter the energy cascade of your body. And that's fine. It's fine for most people because most people can do it. But if you have an MTHFR abnormality, which is a genetic abnormality, you have to do genetic tests to find it. It's pretty common actually in the population to have maybe one defect in that system or two. It's less common, but more common to have one. Maybe you don't absorb your B vitamins or get all the energy out of your B vitamins that you might normally expect to have, or someone, maybe your friend's taking a B complex and they have great energy with it, or they can take an energy drink and feel good with it. So if this is an issue for you, it's a very simple fix. You can use an active form of B vitamin or the methylated form of the B complex to bypass that problem. So it's also readily available over the counter. It just is a different form of B vitamin. So that might be something to try if you don't feel like you're getting a lot of energy from your food or your nutrition or from your B vitamins, or you're concerned about that. It's not harmful to take the methylated form instead of the regular form in a normal supplement dosing fashion. I'm not saying go out and take more than 1 or 2 capsules a day based on the supplement that you're purchasing, but just something to think about that maybe you are actually metabolically being hindered in terms of how you're going to get your energy from your vitamins because of genetic abnormalities. And these things are out there in the world. They're not unknown. It's not a secret. So there are people who have bad genetics with their B vitamins. There are people who have bad genetics with their D vitamin as well. So none of this should be construed as medical advice. This is just my observations over the years of doing this in the practice and some of the simple tricks and tips we have of addressing these problems or identifying these problems. But just a little few tips about, if your fatigue feels like more than just you're not getting good enough sleep and you're eating what you're supposed to be eating, and you're exercising what you're supposed to be doing, and you've been attending to your health, and you've been getting regular checkups, and maybe there's just a few things out there that you've not thought about. So there are many, many more beyond that. I'm just giving you some really easy tips and tricks that you can resolve on your own minute, maybe, without requiring additional intervention or additional testing. Just something to think about. So I hope that helps. Have a good night.